1000 mg of a drug is delivered in a patient by a technique shown in the figure, the steady state plasma concentration of a 50 mg per liter is achieved. So what will be the apparent volume of distribution? So apparent volume of distribution is the extent the drug distributes to various bodies or tissue spaces. So the options given are 20 liters, 50 liters, 0.05 liters and 950 liters. No, we have to know few certain basic principles. Okay, what is this apparent volume of distribution? This apparent volume of distribution is the extent to which your drug distributes to various body tissues or your spaces. Okay, medications which have a very large volume of distribution, say if you have a large volume of distribution, they have a lower blood concentration because it is concentrated in all the tissue spaces and other spaces, so your blood concentration will be low. And medications with your smaller volume of distribution will have higher blood concentration. This thing you have to know. Okay, and the factors which will decide the extent of distribution will be your protein bound, highly protein bound. One is your highly protein bound drugs, and which have high affinity to body fat. Okay, high affinity to body fat. Okay, so two things, one is your highly protein bound and one is high affinity to your body fat. These are the two factors that affect the extent of distribution. So this loading dose, okay, you have something called your loading dose, is used when you have large volume of distribution. So other thing that you have to know is volume of distribution is equal to your dose administered, okay, dose administered by your plasma concentration. Okay, plasma concentration. Okay, now this volume of distribution can be very small if the drug is primarily contained in the blood. I told, for that example you have warfarin. Okay, warfarin, your volume of distribution will be around 5 to 7 liters only, or it can be large if the drug distributes widely in the body. Okay, for example you have digoxin, which is around 500 liters. Okay, and one more important MCQ, chloroquine. It has the highest volume of distribution, around 1300 liters. Okay, so one more thing that you have to know from a clinical aspect. Your clinical aspect will be, say if he's a larger, if he's a bulky person weighing around 90 kgs, okay, he would be expected to have a large volume of distribution, okay, for a drug than a smaller person weighing around 50 kilograms, like elders, like grandparents. Okay, so for this example, the drug binding in the blood or serum compared to the binding in the tissues. So what you have to infer is that warfarin, I told about warfarin, right? It has a very smaller volume of distribution, right? This is because this is highly bound to serum albumin. Serum albumin, so that the free fraction of a drug is very small, right? You have to understand three important things. One, what is your formula? Dose administered by plasma concentration. And you have to know the principles, factors affecting the volume of distribution. Coming to the question, okay? Coming back to the question, 1000 mg of a drug is delivered. So we told VD is equal to dose administered by your plasma concentration. So 1000 divided by a 50, which is equal to 20 liters. So answer for this question will be 20 liters. So in this question you have to know what is volume of distribution, what is the formula, how is larger VD calculated, smaller VD, factors affecting the distribution, right? I hope this is clear.